Our blood is a fascinating and complex fluid, a marvel of biological engineering that sustains life in ways we often take for granted. It plays a critical role in keeping us alive, acting as the body's transportation system, defense mechanism, and repair crew all rolled into one. Blood is responsible for transporting oxygen from our lungs to every cell in our body, ensuring that each cell has the energy it needs to function. It also carries carbon dioxide, a waste product, back to the lungs to be exhaled. But that's not all. Hematology is the branch of medicine that focuses on this vital fluid, specifically on the diagnosis and treatment of blood disorders. This field is crucial because blood disorders can affect every part of the body, from the brain to the toes. These disorders can range from common ones like anemia, which is a deficiency of red blood cells or hemoglobin, leading to fatigue and weakness, to more complex conditions like leukemia, a type of cancer that affects the blood and bone marrow, requiring intensive treatment and care. Understanding hematology is crucial because it provides valuable insights into our overall health and well-being. Blood tests can reveal a lot about what's happening inside our bodies, from infections to chronic diseases. Think of your blood as a bustling city. Just like a city has various systems in place to keep it running smoothly, your blood has different components that each play a unique role. Red blood cells are like delivery trucks, transporting oxygen throughout your body. They pick up oxygen in the lungs and deliver it to tissues and organs, ensuring that every part of your body gets the oxygen it needs to function properly. White blood cells are like the police force, constantly patrolling and fighting off infections. They identify and destroy harmful invaders like bacteria and viruses, keeping your body safe from disease. Platelets are like tiny construction workers rushing to patch up any injuries and stop bleeding. When you get a cut, platelets gather at the site to form a clot, preventing excessive blood loss and allowing the wound to heal. When there's a problem in this intricate system, it can impact the entire body. Blood disorders can lead to a range of symptoms and complications, making it essential to diagnose and treat them promptly. That's where hematologists come in. These specialized doctors are experts in diagnosing and treating blood disorders. They use a variety of tools and techniques to investigate the causes of blood-related issues and develop effective treatment plans. Hematologists are like detectives, using various tools and techniques to investigate and diagnose blood disorders. They analyze blood samples under microscopes, conduct genetic tests, and use advanced imaging techniques to get a clear picture of what's going on inside the body. Once they have a diagnosis, hematologists develop personalized treatment plans to address the specific condition and help patients regain their health. This might include medications, blood transfusions, or even bone marrow transplants, depending on the severity of the disorder. In the following sections, we'll delve deeper into the fascinating world of hematology, exploring the key diagnostic tools and treatments used to understand and manage blood disorders. We'll also hear from patients and doctors about their experiences and the latest advancements in this critical field of medicine. One of the most fundamental tests in hematology is the complete blood count, often referred to as the CBC. This test is a routine part of medical checkups and is crucial for diagnosing a variety of conditions. It's a simple blood test that can reveal a lot about your overall health. By examining the different components of your blood, healthcare professionals can gain insights into your body's condition and detect potential health issues early on. This simple blood test provides a wealth of information about your blood cells, including their count, size, and shape. It's like having a detailed report card for your blood, offering a snapshot of your health at a cellular level. The CBC can help identify a range of issues from infections and anemia to more serious conditions like leukemia. Acting like a window into your overall health, the CBC can reveal abnormalities that might not be apparent through physical examination alone. For instance, it can detect subtle changes in your blood that could indicate the early stages of a disease, allowing for timely intervention and treatment. Imagine receiving a report card for your blood. The CBC is exactly that. It provides detailed information about the different types of cells in your blood, including red blood cells, white blood cells, and platelets. Each of these components plays a vital role in maintaining your health. The CBC is exactly that. It tells us how many red blood cells, white blood cells, and platelets you have. Red blood cells are responsible for carrying oxygen throughout your body, white blood cells are crucial for fighting infections, and platelets help with blood clotting. It tells us how many red blood cells, white blood cells, and platelets you have. Additionally, it measures the size and shape of your red blood cells, which can provide clues about various health conditions. For example, abnormally shaped red blood cells can be a sign of a genetic disorder, like sickle cell anemia. It also measures the size and shape of your red blood cells, which is important for diagnosing conditions like anemia and other blood disorders. The CBC can also detect variations in the size of your red blood cells, known as anisocytosis, which can indicate nutritional deficiencies or bone marrow problems, and provides details about the different types of white blood cells present. White blood cells are a key part of your immune system, and the CBC can help identify whether you have an infection, inflammation, or an immune system disorder. By analyzing the different types of white blood cells, doctors can pinpoint the cause of your symptoms more accurately. Each component of the CBC provides valuable clues about your health. For instance, a high white blood cell count might indicate an infection or inflammation, while a low count could suggest a problem with your bone marrow or an autoimmune disorder. Similarly, the number and quality of your red blood cells can reveal issues like anemia or dehydration. For instance, a low red blood cell count, known as anemia, can lead to fatigue and weakness. Anemia can be caused by a variety of factors including nutritional deficiencies, chronic diseases, or bone marrow problems. Identifying the cause of anemia is crucial for determining the appropriate treatment. An elevated white blood cell count might indicate an infection, as your body produces more white blood cells to fight off bacteria, viruses, or other pathogens. However, it could also be a sign of stress, inflammation, or more serious conditions like leukemia. While a low platelet count could increase your risk of bleeding. Platelets are essential for blood clotting, and a low count can lead to easy bruising, frequent nosebleeds, or excessive bleeding from minor cuts. This condition, known as thrombocytopenia, can be caused by a variety of factors, including certain medications, autoimmune diseases, or bone marrow disorders. The CBC is often the first step in diagnosing a blood disorder. It provides a comprehensive overview of your blood health, allowing doctors to identify abnormalities and determine the next steps for further testing or treatment. Whether you're experiencing symptoms or undergoing a routine checkup, the CBC is a valuable tool for maintaining your health. It can also be used to monitor the effectiveness of treatments. For example, if you're undergoing treatment for a blood disorder or cancer, regular CBC tests can help track your progress and adjust your treatment plan as needed. This ongoing monitoring is crucial for ensuring that your treatment is working and making any necessary adjustments, and track your progress over time. By comparing your CBC results over time, doctors can see how your condition is evolving and whether your treatment is effective. This helps in making informed decisions about your healthcare and ensuring the best possible outcomes. This simple yet powerful test is a cornerstone of hematology. It provides essential information that can guide diagnosis, treatment, and monitoring of various health conditions. Whether you're feeling unwell or just having a routine checkup, the CBC is an invaluable tool for understanding and maintaining your health. While the CBC provides valuable numerical data about your blood cells, sometimes we need a closer look. The complete blood count, or CBC, is a fundamental test that gives us a broad overview of your blood's health. It measures various components, such as red blood cells, white blood cells, hemoglobin, hematocrit, and platelets. However, these numbers alone don't always tell the full story. That's where the peripheral blood smear comes in. This test is a more detailed examination that can reveal subtleties and nuances about your blood cells that a CBC might miss. In this test, a drop of your blood is smeared onto a glass slide and treated with special stains. These stains highlight different components of the blood cells, making it easier to see their structure and any potential abnormalities. This allows hematologists to examine the size, shape, and appearance of your blood cells under a microscope. By doing so, they can identify any irregularities that might indicate underlying health issues. Think of it like looking at a drop of water from a pond under a magnifying glass. Without the magnification, the water might look clear and clean. But once you zoom in, you can see all sorts of tiny organisms and particles that were invisible to the naked eye. Suddenly, you can see all sorts of tiny organisms that were invisible to the naked eye. This analogy helps us understand the importance of the peripheral blood smear in medical diagnostics. Similarly, the peripheral blood smear allows hematologists to identify abnormalities in blood cell morphology, that might not be evident from the CBC alone. For instance, they can detect variations in cell size, shape, and color, which can be crucial indicators of specific health conditions. This test can help diagnose various conditions, including different types of anemia, infections, and certain blood cancers. Anemia, for example, can present in several forms, each with distinct characteristics that can be identified through a peripheral blood smear. It's a valuable tool that provides a more detailed picture of your blood cell health. By offering a closer look, it helps healthcare providers make more accurate diagnoses and tailor treatments to your specific needs. In essence, the peripheral blood smear is an indispensable part of modern hematology, giving us insights that go beyond numbers and into the very essence of your blood's health. To further investigate blood disorders, hematologists sometimes need to examine the bone marrow. This is where blood cells are produced, and it holds important clues about various blood diseases. Two common procedures used to examine the bone marrow are bone marrow aspiration and biopsy. In aspiration, a needle is inserted into the hip bone to withdraw a small amount of liquid bone marrow. This allows for analysis of the cells and their maturity. Biopsy, on the other hand, involves taking a small sample of solid bone marrow tissue, which is then examined under a microscope. These procedures, while they might sound intimidating, are usually done under local anesthesia and are generally well tolerated. They provide crucial information about the health of your bone marrow and can help diagnose conditions like leukemia, lymphoma, and other bone marrow disorders.